Some chronic conditions have the power to inevitably affect your everyday life, and polycystic ovary syndrome is one of them. Between 5 to 10% of U.S. women of reproductive age have polycystic ovary syndrome. It means that this condition is one of the most common hormonal endocrine disorders among women. But what do you really know about this syndrome? Polycystic ovary syndrome is a hormonal disorder in which the ovaries produce an abnormal amount of androgens, the male sex hormones that control the development of male traits, such as male pattern baldness. In healthy women, androgens are produced in small amounts, playing a key role in the hormonal cascade that kickstarts puberty, stimulating hair growth in the pubic and underarm areas. Additionally, these hormones are believed to regulate the function of many organs, including the reproductive tract, bone, kidneys, liver, and muscle. When androgens are produced more than normal, like in women with polycystic ovary syndrome, they cause several problems like irregular menstrual cycle, cysts in the ovaries, weight gain, acne, infertility, miscarriage, excess body hair, pelvic pain, sleep problems, headaches, depression. Further possible complications caused by the syndrome can include endometrial cancer, type 2 diabetes, and non-alcoholic steatohepatitis. The exact cause of this condition is still unknown, but most experts think that genetics and insulin resistance may play a relevant role. Indeed, most of the patients have been shown to have at least one family member with the same syndrome, and a high level of insulin in their bodies, resulting in higher production of androgen hormones. Polycystic ovary syndrome is generally diagnosed through a pelvic ultrasound, which may or may not be accompanied by a blood test to confirm the high androgen level. Generally, the combination of symptoms varies from woman to woman, but unfortunately the gynecologist's solution is always the same: hormonal birth control. Indeed, hormonal birth control is not just used to prevent pregnancy, but also to treat other health concerns such as skin changes and menstrual irregularities. This type of solution is generally pretty effective, but it completely changes the body's balance, causing several possible side effects like depression, increase or decrease in appetite, breast cancer, blood clots, high blood pressure, nausea, migraines. For this reason, because of what the syndrome and its treatment can cause themselves, it becomes essential to assess and consider more natural solutions, reducing all the symptoms without causing any other additional problems. One of these is the use of myo-inositol supplements. Inositol is a type of sugar molecule, similar to glucose, that is responsible of several biological processes in our body. It is contained in many foods like fruits, nuts, whole grains, and vegetables, and it is also in part produced by our body. It exists in different forms called isomers, like myo-inositol and D-chiro-inositol, those generally used in fertility supplements. Multiple studies and thousands of positive reviews from women with polycystic ovary syndrome have found myo-inositol to be an effective solution for the syndrome. Its effectiveness is in part due to its ability to improve insulin sensitivity and, consequently, to restore hormonal balance favoring menstrual regularity, reduction of hyperandrogenism, and restoration of the ovarian function. The suggested daily dosage would be 2,000 milligrams of myo-inositol combined with folic acid, taken 1 to 2 times every day, preferably with a meal. The two brands that are finding a lot of success and positive results, especially among the female Amazon users, are myo-inositol and D-chiro-inositol plus folate and vitamin D, produced by Optify, and myo-inositol and D-chiro-inositol blend, produced by Wholesome Story. Another effective natural solution is the Ayurvedic treatment. The Ayurvedic treatment involves the use of specific herbs to balance the hormones in your body. In particular, turmeric, cinnamon, and Indian ginseng seem to significantly increase the quality of life in patients with the syndrome by decreasing the typical insulin resistance, and by acting as anti-inflammatory agents. In addition, rich of vitamins A, B, C, E, folic acid, and minerals, the asparagus racemosus, also called shatavari, is another effective herb, since it acts as an antioxidant that protects the reproductive system and helps in improving insulin sensitivity. Shatavari Hormonal Balance Supplement by Organic India is one of the most chosen among women. Ayurvedic practitioner recommends also a particular diet and lifestyle based on eating fewer saturated fats, reducing salt intake, eating more fruits, vegetables, and whole grains, avoiding refined sugar, sugary foods, and artificial sweeteners, drinking 1 to 2 liters of water every day, and exercising at least 45 minutes per day. Because the severity of the syndrome can vary from person to person, treatment plans are highly individual. It's extremely important to talk to your doctor about all potential treatments and discuss the best option for your body, considering factors such as cost, desire to have children, regular periods versus irregular bleeding, and effectiveness at preventing pregnancy. In any case, remember, you're not alone. Many women throughout the world suffer from the same syndrome, and like them, you are strong enough to go through it. Listen to your body. Respect it. Love it and celebrate it in all its beauty through a healthy and balanced lifestyle. Love yourself until you experience that love every day. If you liked the video, give it a thumbs up and share with your friends. For more topics and tips, subscribe to the channel.